Hello everybody, welcome to this Pain BC webinar about Kelty's Key. I'm glad to be with you today. A little bit of background, I'm a registered psychologist with Vancouver Coastal Health's Kelty's Key Online Therapy Development Team. And in that role, I do three things. I provide online therapy to clients. I train counselors so that they can go out and do online therapy and increase access. And I work with our development team to produce content for the Kelty's Key courses. My personal connection with chronic pain is that, number one, I'm what's called a TAB. I'm a temporarily able-bodied person. But my mother, Beth, has lived with chronic pain for more than half of her life due to a couple accidents she had, pretty severe accidents, and also illness that has left her with chronic pain for the past 40 years or so. So watching my own mom navigate and cope with chronic pain and see the challenges that it has presented to her has really informed my work with clients who have chronic pain. So you might wonder, what is online therapy? We hear quite a bit about it, but it actually comes in different forms. First of all, online therapy brings the adaptability of the internet to mental health, and it can take several different forms. You can do online therapy with instant messaging, video chatting, which a lot of people are familiar with when they hear the word online therapy. It can come in the form of audio messaging, or as with Kelty's Key and the work that we do with clients, it can come in the form of therapeutic email. So we're all pretty familiar with social email. We're checking up with our friends and our family. And sometimes with social email, emoji use is quite freewheeling, and it might be quite informal. And we're also, most of us, familiar with business email, which is quite task-oriented and not so warm. And so therapeutic email lies in the middle. Therapeutic email is intended to be warm, very supportive. It's intended to be strength-based. There's a particular format to how we write therapeutic emails. And it's intended to help further therapy and to benefit the client. Kelty's Key uses encrypted email and interactive online modules. So the work is both the modules and also therapeutic email in partnership. The modules are easy to use. They were written so that they're easily accessible to most people. Sentences are short and they're uncomplicated. And as we know, when people are struggling with pain, quite often concentration is an issue. We know that with chronic pain, a depression can also be an issue. And we know with depression, concentration sometimes is problematic. And so the modules are intended to be easy to take in, the information easy to take in and to use. And we often recommend our clients that most of the work that they're going to be doing is between the modules, meaning that they'll do a module and then they'll use time in the week to practice the new skills that they've learned. So why would a client want to use Kelty's Key? Many, many reasons. There's no need to get to appointments. Clients have sometimes told me that getting to an in-person counseling appointment is like a day-long event for them. If a person is dealing with chronic pain, sometimes their sleep has been interfered with at night, and getting up in the morning to get to an appointment is really difficult. Then getting dressed to get to the appointment, And then the transportation time to the appointment sometimes is pretty long. Then they have their 50-minute appointment, and then they have their transport home. So for some people, it can be like an all-day event just to get to one appointment. Of course, online therapy is useful in terms of increased access. Canada is a large country, and although there are many major cities, as soon as a person gets outside of a major city, access to mental health can be very challenging. And online therapy is one answer to the problems of access to mental health care. People can do online therapy in the comfort of their own home, and that is very attractive to a lot of people from whom it's physically difficult to get outside their home. Clients also tell me that being able to review their therapeutic emails and the letters that I have written to them provides them with support throughout the therapy, because people can reflect back on both what they've written and also how I've responded to them as their online therapist. And it's a source of support. It also provides people further insight when they're reviewing their emails, and they can also keep those email letters forever and refer back to them after they're out of therapy, but maybe they've hit a rough spot in their life and they want to review some supportive, positive, strength-based emails from their therapist. Then there's absolutely the therapeutic benefits of writing. When we write down our thoughts and feelings, we often gain a lot more insight, and we can look back on what we've written to understand a little further about how far we've come in terms of our thoughts and feelings and what's going on in our life. So absolutely, lots of therapeutic benefits of writing. Then we might ask, why would a therapist or a health organization want to use online therapy? We know that it's effective. Online therapy has been proven to be as effective as face-to-face for people for whom it's indicated and for people who complete online therapy. And we know in our program that Kelty's Key has shown an average decrease of symptoms severity by about 45%. And that's huge in mental health. Online therapy is flexible, so treatment or therapy can continue even when a client might be away for work or vacation. In face-to-face therapy, the therapy would stop and have a gap if a person was away. But in online therapy, people can continue their therapy even if they can't make it into an office. And one of the advantages for therapists is that they can reflect before they write a response to their client. And they can consult with colleagues if there's some issue that they need their colleagues' expertise to understand a little better. So they can reflect before writing to their clients, and they might check in with a colleague to get a better understanding of the situation or condition that their client is dealing with. Then it's efficient. Therapists can treat more clients in the same amount of time. This can decrease wait times, and it allows more people to access treatment. When therapists are first starting to learn online therapy, there is a bit of a learning curve. And sometimes in the very beginning, just as when we're learning any new skill, therapy online and therapy face-to-face can take almost the same amount of time because the therapist is learning something that's really new. But once the therapist learns the skills, the time it takes for them to interact with each client or patient goes down dramatically. Kelty's Key has evidence-based content, and you might be familiar with a drawing such as this, the triangle. So this is a Cognitive Behavioural Therapy drawing, CBT for short. And in a very simple way, what CBT is saying is that thoughts emotions, and actions are all interrelated and they all affect each other. For instance, if we intervene at the level of thoughts, that can quite often affect our emotions in a positive way and also affect our behavior in a positive way. Maybe we're able to be a little more active if we address the thoughts that we have about being active. Our courses are freely available to anyone at www.keltyskey.com. And right now, the courses that we have on the site are the following courses. So we have chronic pain. That's the one that we'll talk about today. We have a course on depression, anxiety, substance use, complicated grief, insomnia, and panic. And we at the development team continue to develop new content for the website. So the chronic pain course has 8 different units. The first unit is an educational unit about what chronic pain is and is not. For instance, some of the things that this unit will talk about are the differences between acute and chronic pain. And it will also talk about some of the very common concepts in chronic pain treatment so that users of the course get a little further understanding of what chronic pain is. Then the rest of the units are mindfulness. We have a number of experts who have done mindfulness recordings for us. Pain experts, I should say, that have done mindfulness recordings for us. The clients really like the recordings and they tend to use those over and over again. We have a unit on pacing, a unit on problem solving, chronic pain beliefs, which is the unit that we'll talk about today. There's a unit on challenging thoughts. There's a unit on aligning beliefs. And there's a unit on core beliefs. So the unit that we're talking about today is chronic pain beliefs. And we're going to do a little run through of what a client might experience doing that unit. So this is the page that a client would first see when they come on to the course. You can see that there's different units on that page. And we're going to be looking at this chronic pain beliefs unit. So you can see that's the unit that we're focused on. The first page gives an outline of what the unit is about. The next page gives us a little psychoeducation about beliefs. And then we get to this first exercise, which is a beliefs about coping exercise. And it talks about if you believe that chronic pain will overwhelm you and that things will get worse, you'll likely forget about how you've coped with challenges in the past. And this exercise helps people work through that. So there are some common beliefs around chronic pain, such as my pain will become unbearable, things will get worse and worse, things will never get better, chronic pain will destroy my life. And we'll see that the user is rating their beliefs right now. And then chronic pain shows that activity is damaging my body. And so someone using the course has gone through, and for them, they've rated all those different beliefs. And we can see that the idea that things will get worse and worse is the predominant belief that the person using the unit has at the time that they did the exercise. So we take that belief, things will get worse and worse, and we do some processing with that. First of all, we ask, do you know for a fact that this is certainly true? And it's the user asking themselves if the idea that things will get worse and worse is certainly true. And a person might come up with a thought like this. No, my pain was really bad after the accident, and it has gotten somewhat better. And then if we look at the other side, we're asking people to ask, if you had to convince someone that the belief was not true, that things will get worse and worse, what would you say? And this gives the client an opportunity to look at their belief from a different perspective. So they might say something like, the future is not certain. You can learn to work with what comes. Then we also look at both sides of the benefits and the downsides of having a belief. And whatever belief we have, even though this doesn't seem obvious, there's always some benefit for us to have the belief. So if we were to ask, what are the benefits of holding this belief? We might say, if I believe the worst, then I can't be disappointed. And that's something that might be really realistic with people that are dealing with chronic pain. Then we ask, what are the downsides of holding this belief that things will get worse and worse? And one of the downsides might be something like, I feel helpless and hopeless. When I think this way, it affects every part of my life. So we're done that page. Then the client would move on to the next exercise. And so there's a little bit of education. Again, it's really short, so it's easy for people to read. There's some education about underestimating our own abilities to cope. Sometimes when we worry about the future, we overestimate the things that will go wrong, and we underestimate our ability to cope. So there's a little reading on this page, and then the client is asked to re-rate their belief about things getting worse and worse. So we see that the client now is going and re-rating their belief. And we can see that their belief, so the scale is from 0 to 10, we can see that the belief is a little less strong now that they've done the exercise. Then we move on to a section about beliefs about control. And when people who are dealing with chronic pain believe that they have no control over their chronic pain, they can start to feel helpless. So there's a little bit of education about that. Again, simple words, very short. And then there's an exercise about beliefs about control. So some of the common beliefs that people might have are that I have no control over my pain. There's nothing I can do when my pain increases. The thought that only doctors can help me now. For instance, I can't help myself. That someone else should be able to cure this. Someone else should be able to cure my pain. And then the thought that nobody cares about me. And we can see that the client is now rating those beliefs. And in this instance, the idea that someone should be able to cure this is the strongest belief, or the one that's the most predominant. And so that's the belief that we start to work with. We go through the same set of questions. Do you know for sure this is factually true, that someone should be able to cure this? And the client's writing in an answer. Well, no, but I hear a lot in the media about cures for other health problems. And certainly people with chronic pain who would love a cure to their chronic pain do hear about other health problems that seem to be cured, and that can be frustrating. Then we move on to a question about if you had to convince someone that this belief was not true, what would you say? So this is challenging that thought. And the client is working away at that. So there's lots of medical conditions without cures. Scientists are doing lots of research, but they may not find a cure in our lifetime. And that's really realistic. Then we move on to what's the benefits of holding on to this belief? What are the positives or benefits? And a positive or a benefit of holding on to the belief might be something like, I have really suffered, and I have someone to blame this way. And then the downsides. What are the downsides of holding a belief like this? And some of the downsides might be that I stop taking charge of my own health and I leave it up to someone else, which is, as you can imagine, might leave someone feeling quite helpless and hopeless, as if they couldn't do anything about their situation. So that page is done. And then there's some education around how common it is to feel helpless when a person has chronic pain. Then the client would re-rate their belief. So someone should be able to cure this is the belief, and the client re-rates the belief. You can see now that the clients have the pages that we've just worked on show up for the client, and the client can print off these pages so that they can refer to them later. The client can also attach the worksheets that they've done to an email. They would send it to their therapist so that the therapist has a good idea of not only what they've worked on during the week, but also their responses and how they're feeling about the work that they've done. So that's page 1 that we worked on today. That's page 2 and page 3 of the downloads for people. If you'd like to get involved, we have free training that we offer. We offer a free 2-day training session in Kelty's Key, and it's a combination of training people in Kelty's Key and also the nuts and bolts of teaching people how to do therapeutic email. So we teach therapists to go through Kelty's Key as a user so that they understand the units. Then we teach them the nuts and bolts of how to write therapeutic email. And again, there's a specific way to write therapeutic email that's warm, supportive, strength-based, and moves the therapy forward. And then we also work with people to see how they could incorporate it into their current practice. We take referrals to work with people on online therapy. And availability for the online therapy varies by location and by the age of the person. So it's not an upper age. We can actually work with people. There's no upper limit to the age we can work with people as long as they can read and write and can use a computer. We don't work with very, very young people, and that might be something that we develop in the future. We're also training widely. So more and more, we're training more people in the province of British Columbia to do online therapy. So as time goes on, there will be more and more people trained. That will increase access to clients. And our phone number for referrals or any kind of questions you might have about our program, about our project, is 604, that's the area code, 875-4111. And our local is local 23614. And you will get right through to our development team if you call that number. This is our development team. You can see Dr. Francois Bota. He is the project lead. He's a psychologist. That's myself. Yona Gellert is our technology innovator advisor, and our project coordinator, Andrew Reyes. Our program, Development and Training of New Online Therapists, is very generously supported by the Vancouver Coastal Health Authority, the Kelty Patrick Dennehy Foundation, and the Royal Bank of Canada. We're now open for any questions that you might have. You can also see if you're watching at a later date, we've included our email address so that you can drop us a note and we can answer any kind of questions you might have about online therapy at a later date. And that address is keltyskey@vch.ca.
Thanks, Margaret. So if anyone has any questions for Margaret, you can just enter them into the Q&A. Okay, Linda has a question, which is great. And she's wondering, how long has this program been going for?
This project has been going for about 3 years. That's right from the start. So getting people together to develop the material, the content, getting the website up, and in the past year, we've started training people widely, and seeing more and more clients because we've been training more therapists. So more and more clients have been seen this past year.
So have you just have the client? Have you just started seeing clients this year, or you've been seeing clients for the whole 3 years?
We've been seeing clients for the whole 3 years, but as we add more therapists, of course, we can increase access and see more clients.
Yeah, great. Okay, Deanna's got a question. Do you suggest clients ever work through more than one module at the same time? So for example, chronic pain and insomnia or anxiety, because many chronic pain clients have many of these.
Yes, that's a fantastic question. Thank you for asking that question. The course modules and the units are meant to be flexible. So yes, definitely a person might have chronic pain and insomnia, chronic pain and depression, chronic pain and anxiety, and the units are meant to be mixed and matched so that they can fit the client. It's an individualized process or program.
Great. I sort of have a question, or maybe just more of a thought. So, I mean, we know that it can be very hard to access therapy in many parts of the province, both for financial reasons and just sometimes, you know, resources. There's not a therapist. So, and sorry if I maybe missed this in the presentation, but so is the process that they start with the modules and then get access to the online therapy, or how is that integrated?
Oh, that's also a great question. So a person could go through any of the courses as self-help.
Mm-hmm.
One of the major donors, one of their purposes was for this to be open and available worldwide. So anybody can go on and use most of the courses as self-help. But when someone's working with the therapist, generally they will have a referral to a therapist. And then the therapist will do a little assessment with them to see if this is a good fit. Then the therapist will start suggesting different units that the person should start with.
I see. So the referral to the therapist is not through your service.
There are some therapists here, definitely at Vancouver Coastal Health, mm-hmm. but there are therapists that are using this that are in private practice and also that work for nonprofits.
So is there a list of those therapists?
Fantastic question, Jen. That's something that we should be putting on our to-do list.
Yeah, that would be great. I know that our pain support line gets a lot of questions about mental health services, and it would be great to refer them.
Right. And
Yeah.
definitely if you get any calls on your support line, and the person that's handling the line thinks that online therapy might be useful for the person, they can absolutely refer to our give out our phone number,
Right.
so that the person could connect with us directly.
Okay, that's great to know. Okay, a few more questions here. So Linda's wondering, or you mentioned that there was a 45% improvement. What outcome measures did you use to evaluate the program?
That's a question that I'm not sure that I can answer immediately. Definitely, that's a question that I could consult with our program lead and get back to the person if they want to drop us a line or call us. Absolutely, I can do that.
Okay, thank you. Another question from Deanna. What if a client doesn't want to share their information with a counselor?
So again, people can go through the modules self-help, but if, for instance, if we were working in face-to-face therapy with a person, and a person really didn't want to share too much about their life, that would be, that would be a point of the therapy, actually, that we would try to encourage people to be able to share a little bit more about what they're experiencing and what they're going through. Clients do not have to send their worksheets to their therapist to show them the work they've done or show them what kind of ideas they have, but it really helps to further the therapy.
Okay, thank you. And final question from Emily. Where is information about the 2 days of training? They looked on the website and they can't find a list of dates.
Right, okay. That would be, if anybody wants any more information about the 2-day training, they can just call us directly at the 875-4111 area code 604 number, local 23614, or email us, and we can certainly provide the dates for the training.
So is it offered a few times, like a few set times a year, or is it sort of based on demand?
It's based on demand, and it's offered many times throughout the year.
Okay.
So we don't offer training every single month, but we offer trainings throughout the year.
Great. And how many therapists do you think you've trained so far?
We've trained about 70 so far.
70, right? Okay, that's a big list.
And probably 100 in the next. It'll amount to about 100 in the next several months.
Yeah, that's great. Okay. Well, if there's no other questions, just like to say thanks so much, Margaret. That was a really interesting presentation, and I think it's a great resource for people who are living with pain and who are looking for some support around, all of the many complex aspects of it. So thanks so much for sharing this resource with us.
Oh, you're so welcome, and thanks for everybody that joined the webinar today.
All right, we will, I hope everyone has a great week. Bye-bye.
Bye.